Hi, and welcome to Heads Up Coping Through COVID-19. I'm Audra Burns, Media Relations Manager at Dartmouth-Hitchcock, and your moderator for this series. Today, we're going to be discussing employees' concerns, fears, and anxieties as they return to the workplace after being either fully remote or working hybrid since March of 2020. I'm excited to have two incredible guests with me today. We have Tracy Hutchins. She is the president and CEO of the Upper Valley Business Alliance in Lebanon, New Hampshire. Hi, Tracy.
Hey, Audra. Thanks for having me.
And we have Robert Brady, PhD, psychologist at Dartmouth-Hitchcock Medical Center and the director of the Anxiety Disorder Service at Dartmouth-Hitchcock. Hi, Robert.
Hey there. Good to see you.
You too. I'm so thrilled that we have both of you. I think you're both going to bring a unique perspective to this really important conversation that we're going to have. So Robert, how about we start with you? Many employees, they feel anxious about returning to their workplace for several reasons. What tips do you have for people who are feeling anxious or maybe overwhelmed about going back to work in person?
Well, thanks, Audra. That's a good question. I think it's one that a lot of folks would connect with. So the first thing I try to remind folks is anxiety is not the enemy. Feeling anxious doesn't mean there's something wrong with you. It is a natural response that we have when we see some kind of threat, and that could be an internal threat, like feeling a sense of uncertainty or being in a more crowded area after we've been relatively isolated. The problem really becomes when we're unaware of our own anxiety and when it's beginning to get in the way such that we're avoiding doing things that we need to in our daily lives. So what I have been advising people to do when they're feeling anxious in the moment is to ask, what am I responding to right now? What's the thing that's provoking the anxiety? And then ask, what am I thinking about that thing, whatever it is? So there's a lot of power in knowing what you're assuming about the outcome of any given situation. So for example, if I'm on my way to work and I think, today's surely the day that I'll be exposed to the virus, I would want to ask, how do I know that assumption? Why today? How do I know that it happens today? And maybe even consider all the other days that didn't occur, all the other days that I've been safe. And that helps me to balance out that assumption that it has to be a bad outcome today. So this can take a little bit of practice, but it can be very anxiety relieving to simply be a little more thoughtful about our thoughts, the ones that are provoking some of that anxiety. And then the other thing is I hear people say, well, I'm just supposed to snap back. And I try to remind folks there's no rule that says you have to snap right back into place as though nothing has happened. We've all been in this situation to some degree over the past year plus. So there's a little bit of that shared struggle with others as we're trying to resume our old patterns again.
Mm-hmm. That's really great advice. I think that not only, are we easing back into putting socks and shoes on when we have to leave the house because we can't work in slippers, we're also easing our way back to knowing it's going to be a little bit awkward and a little bit uncomfortable going back. But like you just said, anxiety is not the enemy, and just recognizing it and knowing what it is, and that we're all kind of in the same boat here. So fantastic.
Exactly.
So Tracy, something else that people may have gotten accustomed to over the past 16 months from working home is the ability to, multitask, do household chores, personal errands, or, being able to do a workout class virtually right at 5 o'clock because they no longer have that commute. So how can people successfully readjust their work-life balance? Because it is critical for them to maintain that work-life balance, but how can they make that adjustment so they have the positive outcome for their own mental health?
Yeah, thank you, Audra. Well, for some people, that work-life balance meant that their work bled into their personal life because there was no time to transition. There was no going from one location to another. So I would say, for a lot of employees, focus on the positives of going back to work, the things that you might have missed about your job previously, which was, the camaraderie between your coworkers and the ability to bounce ideas off each other and to brainstorm problems, to, dressing up for work. I know I was very happy to take sweats off after a while, and to kind of use that commute time to make that mental transition between one location to the other. I know for myself, I found when I'm working at home that work didn't stop. Sometimes I continued thinking about it. I had a tendency to maybe work a little bit longer. And now, as I'm back in the office, it's nice when I do that commute back to my home to, listen to an audio book or take a little time just to sort of mentally make that transition from one part of my life to another one.
That's a really important point that you make. I think a lot of us forgot, our favorite radio stations, our favorite podcasts, like all these things that we would do during our commute time that helped us, balance out our thoughts and prepare for the day or wind down from the day even. That's another positive to look forward to. So really great advice. Robert, after 16 months of remote work, people might honestly forget how to interact with coworkers in person. Especially since, employee vaccination that might be unknown from each other. So what advice can you share for how people might be struggling to kind of act normal around others in the workplace? What advice do you have for them?
So I love this question, and it's one that existed before the pandemic and will absolutely exist long after. How do I appear as though I am acting normal? In short, it's worth asking, how certain are you, and how do you really know that anyone is really as concerned with your behavior as you are, or as you think they actually might be? So in this context, in this time, remember, we're all going through this period of readjustment and getting back on our feet. And if that's the case, if we're all kind of in this together, then we're all focused on ourselves. We're probably not focused on each other's behavior and observing things. I'd be willing to bet that most people are much more concerned with how they are acting than any one other person's actions. And if you are skeptical about that idea, ask yourself, when's the last time someone actually walked up to you uninvited and commented on something that you were doing that they observed? I have a hard time coming up with that myself, but even when I can, it's almost never a negative thing. In fact, it's probably either totally neutral or maybe even a little bit positive. And then the other message I try to remind people of is your workplace behaviors, the good habits that you have, and if you're like me, some of the bad habits you have, they developed overnight or even over a year or two. Sorry, they did not develop overnight or over a year or two. Instead, you develop those habits over many years and thousands of interpersonal interactions. So I don't want to minimize the concern, but there may be a little bit of it's like riding a bicycle, and we can expect that those good habits will come back to us fairly quickly.
Mm-hmm. That's great advice, that as long as it took them to form into habits, it could also take time to readjust back into habits, and that we need to be, patient with ourselves.
Right.
And speaking, start about patience, Tracy, the service industry, they've been really hit hard from the pandemic, from business closings to staff shortages to, unfortunately, unruly customers. So besides telling people just be nice, what can we do as patrons of local restaurants and shops? What can we do to help as customers, to help employees of those businesses to feel less anxious and overwhelmed at work?
Yeah, the businesses have struggled quite a bit. And, the good news is our economy was very robust before the pandemic, and it's bounced back. But there are some issues, like you mentioned, that have continued. Staffing shortages are extreme in some cases for, particularly the restaurant industry and hospitality. And also, a lot of our businesses are still experiencing supply chain issues. So as a customer, it can't be said enough just to try to be understanding. When you go into a business and you're frustrated, and understandably so, when service is slow or the item that you were hoping to purchase isn't available, don't take it out on the person who's trying to help you. It's frustrating for them as well. So really, understanding can go a long way with a lot of helping these employees feel less anxious in their workplace.
Mm-hmm. And knowing that they are feeling anxious. So we certainly don't want to contribute to that. So, being thoughtful and patient with them, right, like you said, is important. So Robert, fall's coming, events are starting to potentially come back. The Delta variant is still out there, but there's, in-person meetings that are starting to happen. When we've all kind of been doing things like we are now virtually. So with the unknown factor is we don't know who is vaccinated and who's not vaccinated, whether to wear a mask or if we're going to shake hands or not shake hands. So all of that leading up to potentially going to one of these events can be anxiety provoking and panic attacks. So what advice do you have for managing those feelings of anxieties for people who have to attend in-person work functions?
Yeah, it's a good question. It's a tough one too. I mean, I don't make recommendations on how people engage necessarily, because there are these excellent organizations like the CDC, healthcare providers who can do that for us. But what I do remind people of is that anxiety can sometimes have a hard time kind of following the rules. And what I mean by that is there can be a recommendation from a reputable organization, and then anxiety kind of says, nah, I got to do more. And what a person's actually trying to do at that point is guarantee absolute certainty of safety. And that's not really something that we can do. We can chase that feeling of certainty, but it's always sort of elusive. We always feel like we have to do more. So instead, what I try to get people to do is take a safe enough attitude in which they're putting into practice what's recommended by the people with the best information at the time. And the reason for that is if I start trying to make my own rules, that's really a nonstop process. It's always going to be one more thing if I'm trying to chase that feeling of uncertainty. So this doesn't mean that you have to go out and violate your own personal standards for safety, but it may mean asking if your standards are in line with kind of the best available evidence. And if not, why? Am I doing this because I'm not willing to accept any level of uncertainty? And if so, is that worth kind of re-examining for myself? And then the other thing I remind folks of is the behaviors that right now might feel a little uncomfortable or abnormal because you haven't been engaging in them. When you do them over time, just like anything that felt uncomfortable the first time, the more that you do it, the easier it gets. And that's probably something people have experienced across all domains of their life.
Mm-hmm. And like you said, there's organizations out there like the CDC who is constantly updating guidelines. So if you're ever feeling unsure, people can go to reputable sites like the CDC for their latest guidelines on indoor precautions that need to be taken.
And ask your healthcare provider. They're there for you. They are attentive to your specific healthcare needs. So that's an open line of communication as well.
Yep, absolutely. So Tracy, the Upper Valley Business Alliance recently conducted a survey of, your members on vaccine mandates, mask wearing policies, and other COVID-related questions. And I'm excited that you have this data for sharing today. So we're going to go ahead and put it up on the screen. So Tracy, can you kind of speak to what these results are showing?
Yes, thanks, Audra. So we put out a survey. It is not a scientific survey, but we just wanted to take the pulse of the business community. And so we asked them a few questions. One was about your business requiring employees to wear masks indoors. And the light green that you see on your screen is yes, and the darker green is no. And then the blue or blue-green color in between is no, but we plan to. So you can see with that question that quite a few of our local businesses are asking employees to wear masks indoors. Of course, that does take into account that 2 of our towns in the Upper Valley do have an indoor mask mandate, and that's Hanover and Lebanon. But quite a few businesses are asking employees to do it anyways, just for safety precautions. And then we did ask them, is your business requiring employees to be vaccinated? And you can see from the dark green color that indicates no, that most employers are not requiring employees to be vaccinated. However, it does say, is your business asking customers or clients to wear masks while in the business? And quite evenly split there. But it's about 50-50 businesses that are asking their customers to also do that. And in some of our open-ended questions, our businesses indicated that really the health and safety of employees was really one of their top concerns for that. And then we also asked about businesses implementing incentives for employees to get vaccinated. And most are not, but about a quarter are. And those incentives would be anything from paid time off to gift cards or some sort of financial incentive. But in our open-ended questions, a lot of the employers indicated that although they were not going to require vaccinations of employees, many were encouraging their employees to be vaccinated, and they felt that it was very important for us to get through this pandemic, and the sooner that we do it, the better for everybody.
Mm-hmm. This is really great information to have. I'm very thankful to the Upper Valley Business Alliance for doing this, because I'm sure there are a lot of smaller businesses out there who just at the time wasn't quite sure what everyone else was doing in the area. And it's, I'm sure, reassuring when they can look to this resource and information. So we'll be sure to link your website to our resource page as well, because I think what your alliance is doing is wonderful. So before we wrap up, I want to ask each of you, what is a key takeaway from today's conversation that you really want people to remember? Robert, let's start with you.
Sure. In part, I'm reiterating something I said before. If you're experiencing heightened anxiety in this moment in our history, you are not defective. There's not something wrong with you. Anxiety is a response we all have in order to stay safe. Our job becomes recognizing when that anxiety is getting the better of us. And for me, that rule of thumb is if it's getting in the way of me doing the things that give me that full life, even in situations where it's safe enough, then I might want to dial back the anxiety. And if I find that I'm struggling with that, or if anxiety is so essentially painful, then it might be time to seek kind of that services from a mental health specialist and your primary care provider and others in your healthcare team and others that personally can help you to identify those resources. And there are mental health providers who want to help, and some of the sources for help may not look like the traditional sitting in a room therapy. There are online means of therapy. There are self-help smartphone apps that you can download that can help to manage some of the stress at this time. So we have people that want to help you, and there is help available. I will share very quickly, there is a website, the Anxiety and Depression Association of America, that actually has a presentation right now available for people who are struggling with the idea of getting back into their work or into their social settings, and that can be a really helpful resource as well.
Perfect. Thank you for that. We will definitely link to that in the resource opportunity for this video. Tracy, what about you? What's your key takeaway?
Well, early on in the pandemic, there were a lot of slogans going around, but one was we're all in this together. And I think, as the pandemic goes on, maybe we forget that sometimes, but it's still really true. We're still making our way through this. And if you're an employee and you're having anxieties, I would talk to your employer, I would talk to fellow employees. And if you're a customer, I would say, a little levity and a little understanding goes a long way. Let's just remember we're trying to get through this.
Mm-hmm. We are all trying to get through this together, that's for sure. Thank you both for joining me today.
Thank you.
Thanks.
And thanks everyone for viewing this. This is our third installment of the Dartmouth-Hitchcock Heads Up Coping Through COVID-19 series. And the resources that my guests mentioned today will also be linked on our website, along with all of our previous episodes. So please visit the link on your screen to go through all previous episodes for all the important information to help you through this challenging time. Our next Heads Up conversation is going to be talking about returning to the workplace from the employer's perspective. So we look forward to joining you then. Thank you for watching. Stay healthy and stay safe.